Hello, my name is Will Roddy, and today I'll be talking about the Week 12 Let's Talk About It processing our tours of the mortuary and cemetery. So, to start off, how did I feel as I pulled into the parking lot of the funeral home tour as well as the cemetery? Well, the funeral home tour was a bit more nerve wracking as I don't frequent funeral homes, but the cemetery was pretty normal. Nothing really to report about the cemetery just because the one that I chose was the one where some of my family has some burial plots on. So it made it a little bit easier just knowing where to park and everything. As for the funeral home tour, I was a little bit nervous going in there because I felt as though me parking there would just take up a parking spot that would be better suited for somebody who's grieving one of their dead family members. I remember back last fall when my buddy Cole died, we practically took up the entire parking lot and some of the back roads too, just surrounding the funeral home. And that kind of made it so me thinking that if I parked there, then that would just make it so I'm just taking up a spot for somebody else that could better use it. Other than that, um, my overall mindset was excitement just to go figure out what this like a new profession is, since I'm not too sure what like the profession for funeral homes are. So just being able to learn something new regarding that was something pretty interesting, and I was excited for it. Okay, and then describe how I felt and what I thought while I was experiencing different parts of the funeral home tour. Most of the tour consisted of me and the funeral home director just sitting in a closed discussion room, um, just talking about some of the questions that I had previously written down. Um, I did opt to view the casket rooms, and there I was able to see all the different caskets, and I was kind of interested to see that some of these funeral home tours, or the one that I visited, was kind of like a one-stop shop. So you could buy the gravestone, you could buy the what's it called, the casket there, you could buy urns, rental caskets, and some other things there too. And I was kind of just interested to see that that's kind of how it was all set up, that you could just go to the funeral home and then just kind of take care of all that kind of stuff. Pretty much everything except for the actual buying of a burial plot. The other thing that I found very interesting was how the bodies were embalmed and cremated. So with some of the embalming processes, I talked about like how like that worked, and the funeral director told me that the way that they do it is they kind of just connect the deceased person to like in their right carotid and right jugular, and through the carotid they pump in chemicals such as formaldehyde to pretty much just embalm the body, just do what we already know that embalming fluids do, and then they could suck up all like the body fluids consisting of blood, and other various secretions through the jugular back into the machine. So they pump it in, and then they pull it out too, all on the right side. And that was really interesting for me since I work in a cardiac cath lab, and they like to do a lot of like the right heart procedures by going in through the right carotid, or pretty much just the right side. They like to go through the right carotid to get to the right side of the heart, pretty much. And so it was interesting just to kind of piece it together that you go, you use the right side for pretty much everything, then, in my mind, because of the anatomy. It just makes it a little bit easier to like pass stuff through, and I guess to bring stuff out as well. So that was interesting. And otherwise, I felt really interested just learning all this stuff. And nothing was really confusing or overwhelming for me. And um, I wasn't too nervous once I actually got into the discussion, was able to talk. Pretty much my nervousness was just sitting outside in my car. And I was looking forward to pretty much just talking with the funeral director and just seeing like what all these different processes entailed. Because even though I've been on the other side with a family member that they've taken care of, I never knew how they took care of them. So it was really interesting just to see how they actually did do that. And then I haven't really toured a funeral home before in the past, so I wouldn't really know. And however, for the cemetery, it's just same old. I felt as though I was just in the same cemetery that my family's burial plots are, and just because of that, I kind of knew where I was, what I was going, what I was looking for, and vice versa, or pretty much all that. Then 3, describe how I felt and what I thought while taking a tour of the cemetery. As previously stated, I didn't really feel any different from anything else. The cemeteries, in my opinion, are very calm and healing places, so every time that I go to a cemetery, I just feel calmed and healed, or those kinds of vibes, or emotions, as I should say. Very calm and healing place, and nothing really surprised me. Nothing made me uncomfortable. It made me comfortable being able just to use this opportunity as a way just to go visit my family's burial plots again. Um, Pretty much everyone knows that I haven't been able to really take the time, considering everything, to actually go and see them. So just using this as kind of like a scapegoat to actually go and visit my family again was nice. It was comfortable doing that. And then yeah, I've been to this cemetery, other cemeteries multiple times, so nothing really threw me for a loop there. Then how did the tours impact me professionally and personally? Um, so as for cemeteries, it didn't really impact me as much as it has already impacted me. I've already been there and such, so nothing new with that. However, being able to just discuss with the funeral home director and then just it revealed the more human side of the profession than I would have expected to be there. And like as I've said before, I've been on the other side, so I've been treated, but I've talked and had discussions with these people before. However, I've never really connected with them on more of a personal route. So being able to do that really impacted me both personally and professionally, just to see that these people whom everyone sees like very professional, like they're just the people that are there during your hardest like times of your life. And so being able to just see their more human side and being able to just talk to them without having them give that professionalism shroud that they usually give when you're there for a funeral was just very nice to see. And that pretty much has impacted me, just to talk with them on a human sense than a client sense. And it would help better relate to patients and families in future as a healthcare professional, because I kind of understand now a little bit more what entails when somebody dies. So for this funeral home that I toured, they pretty much said that once somebody dies, like they're kind of on call. So if they're there during the day, then no really big deal. They can just head out and then go meet with the family and then get everything all taken care of right then. But they're on call for nights, and they do like on call schedules. So I learned also in bigger cities that are able to employ more funeral directors for these funeral homes, they can have more of a schedule with their being on call. But in like smaller towns, some of these funeral directors are just there 24/7. They can't really go out and do anything else, since their primary gig is being a funeral director and having to be on call, just because there's nobody else to do it. So just seeing the differences between both small and bigger funeral homes and cities, was able just to make it so I kind of understand a little bit more what's happening with that sense, and just hearing that they have like a certain amount of time to get out to the family and such between getting like the call and then getting out there. So I know that, and then I know a little bit more about what the process is. So like if they die in a facility, depending on, they might have to go to they have to get their body like examined by a coroner, is what I'm trying to think of. So they do that like if they die in a facility and such, like in the hospital, they have to like go to the coroner to like get inspected or something. And that's just for some cases. Other cases, they just go right out, since like hospice. They go right out, and then they take care of it from there. And otherwise, that's most of what I got. I know there's some other stuff that I might be missing out on, but otherwise, those kind of key points that I talked on are some of the more important stuff that I took away from this. So other than that, thank you for the time. I figured this will be a longer video than most, so thanks for watching it through. Otherwise, have a good rest of your day.